Welcome to LPN LaunchPad's review for surgical wound care. This presentation introduces the fundamentals of choosing an appropriate surgical site, using different wound closure methods, managing exudate, and recognizing complications like dehiscence or evisceration. Surgical wound care is critical because proper techniques enhance healing, reduce infection risk, and help nurses detect complications such as dehiscence or evisceration. This topic also appears frequently on the NCLEX, so understanding the basics is essential. Surgical site selection focuses on repairing injuries with minimal trauma. It factors in the type of tissue involved, any existing infection, and the tissue's capacity to support sutures without adding undue stress to the wound area. Key considerations for site selection include evaluating the site's tissue strength, healing capacity, and if it is well vascularized. Well vascularized tissues heal more quickly, while areas with poor blood supply heal more slowly. The risk of infection is higher in contaminated locations like the GI tract, and patient specific factors like obesity, smoking, or diabetes can delay wound healing. NCLEX tip for surgical site selection. Clean sites generally heal faster, while high risk conditions such as obesity, smoking, and diabetes call for close monitoring, especially in abdominal incisions that are more prone to dehiscence. Wound closure is intended to bring wound edges together, promoting healing. The chosen method depends on the wound type, location, and the patient's ability to heal effectively. Sutures or stitches may be absorbable, used internally where they dissolve over time, or non absorbable, which requires removal after a set period, often 7 to 14 days. Nurses should regularly examine the suture line for infection or potential dehiscence. Staples provide strong, quick closure, often for large or lengthy incisions like those in abdominal or orthopedic procedures. They can slightly increase infection risk if not cared for correctly, and are generally removed in the same time frame as non-absorbable sutures. Adhesive strips, steri-strips, are used for smaller, low-tension wounds or to reinforce existing sutures or staples. At the same time, transparent films serve as a waterproof barrier that allows the wound to remain visible. Binders and bandages then help secure dressings and offer incision support. NCLEX tip for wound closure. Staples are efficient for large incisions, absorbable sutures do not require removal, and steri strips are reserved for minor wounds or as reinforcement. Wound exudate is fluid that emerges from a healing wound. It offers insight into whether healing progresses normally or complications arise. In the immediate post surgery period, sanguineous, bloody drainage is common, transitioning to serosanguineous, pink, watery, within 24 to 48 hours, and eventually serous, pale yellow, thin, in later stages. A typical progression should move from bloody to pink to clear drainage. Nurses frequently inspect exudate, hourly in the first 4 hours post op and every 2 to 4 hours afterward. Any excessive bright red drainage could signal hemorrhage, while purulent drainage suggests infection. Thorough documentation of color, consistency, and amount is essential. NCLEX tip regarding exudate: sanguineous to serosanguineous to serous is the normal pathway. If drainage is purulent, the infection could be suspected. Bright red bleeding could be a surgical emergency requiring immediate action. Standard wound care steps include hand hygiene and proper PPE, carefully removing the old dressing while noting exudate, cleansing the wound according to orders, often using sterile technique, applying a new dressing without tension, and documenting findings. Dehiscence occurs when wound layers separate before healing is complete. Patients may describe a sudden giving way or experience increased serosanguineous drainage. Physical inspection may reveal a visible gap in the wound edges. Immediate nursing actions for dehiscence include placing the patient on bed rest, reducing tension on the wound, often by splinting with a pillow, covering the area with a sterile, moist dressing, and notifying the surgeon immediately. Evisceration is a more severe form of dehiscence in which organs protrude through the open incision. Signs include visible organs at the site, potential shock symptoms, low blood pressure and elevated heart rate, and severe pain. Evisceration requires emergency intervention. Position the patient in low Fowlers with knees flexed. Cover the protruding organs with sterile, saline moistened dressings. Keep the patient NPO and contact the surgeon immediately. NCLEX. Tip: obesity, infection, coughing, and vomiting increase the risk for dehiscence and evisceration. A sensation of popping, accompanied by sudden drainage, suggests dehiscence, while evisceration is a true medical emergency. Common bandages and binders include gauze, lightweight and breathable, elastic wraps, such as ACE bandages, for support and compression, and flannel or muslin for warmth and extra support. Nurses applying bandages or binders must assess the skin before and after placement, ensuring a proper fit that is neither loose nor tight. They must also regularly assess circulation for signs of pallor or coolness. NCLEX. Tip: incorrectly applied bandages or binders can harm circulation. Monitor for numbness, discoloration, or tingling, and always document each application and the patient's response. NCLEX practice. Question 1. A nurse assesses a post-op wound with bright red, thick drainage on the first day. Which best describes this exudate type? A. Serous. B. Serosanguineous. C. Sanguineous. D. Purulent. The correct answer is C. Sanguineous. This bright red and thick drainage is commonly seen in the immediate post-op period. Pinkish drainage is serosanguineous, and purulent drainage implies infection. NCLEX practice. Question 2. Which intervention is most critical if a patient's abdominal surgical wound suddenly eviscerates? A. Apply direct pressure to stop bleeding. B. Cover organs with a sterile, saline moistened dressing. C. Lower the foot of the bed to a flat position. D. Encourage the patient to take shallow breaths. The answer is B. Cover the organs with a sterile, saline moistened dressing. This will protect protruding tissues from contamination and prevent further injury until surgical intervention can be arranged. NCLEX practice. Question 3. The nurse is applying an ACE wrap to a patient's lower leg. Which finding indicates the wrap is too tight? A. Patient reports feeling supported. B. Toes are warm with normal color. C. Patient can easily wiggle toes. D. Patient's foot becomes pale and cool to the touch. The correct answer is D. The patient's foot becomes pale and cool to the touch, indicating impaired circulation and prompting the nurse to loosen or remove the wrap. In summary, surgical wound care involves selecting appropriate sites, properly closing incisions, monitoring exudate, recognizing and handling complications like dehiscence or evisceration, and safely applying bandages or binders. Key study points for the NCLEX include understanding the progression of drainage from sanguineous to serous, differentiating closure methods, staples, sutures, steri strips, and knowing the immediate steps to take if dehiscence or evisceration occurs. Thank you for exploring these concepts in surgical wound care. Feel free to leave comments about nursing school or the NCLEX. I will respond promptly. Hey there, this is Brian, the creator of LPN LaunchPad. I aim to give every student a fair review for the NCLEX for free using YouTube videos that can be watched or listened to without losing value. It may be free, but it is still valuable. If you find these reviews helpful, help me keep this project alive by hitting the like and subscribe buttons and continuing to watch my videos. Also, check out the free ChatGPT review quizzes I have made to accompany these videos. A link is in the description or search for LPN LaunchPad in the Explore GPT box. This review has been an LPN LaunchPad production. We care for our future nurses by freely sharing knowledge.